Hello, everyone. Welcome to the Image and Wire Show. My name is Jake Fishman. I'm the host of the show and the editor of the Image and Wire. And we have Bill Newsom from Canon Medical joining us today. Bill is the managing director of the vascular business unit, and that's what we're going to be talking about today. Bill, welcome to the show.
Thank you, Jake. It's good to be here.
It's really good to have you here. To start us off, if you could share an introduction to yourself and what you do over at Canon Medical, and we'll take it from there.
Certainly, Jake. I'm with the vascular business unit, and what that does is it controls the angio and the cardiac cath products, where the doctors that actually do the interventional work are using those systems. And I run the team that does that. We have not only the strategic marketing team that's part of that, but we also have the medical affairs team. That's where the clinical scientists and groups like that work. We work directly with the engineering team in Japan. We work directly with our key opinion leaders, our KOLs, in developing product and also seeing the impact clinically here in the United States and around the world. And we help to develop the future products and build the roadmap out. So that's what the marketing department is part of. Plus, making sure that the product is put together right and it's presented right out to the customer base, so they have a great product that's really reliable and really gives them the image quality that they require. I'm kind of in charge of that whole thing. And I come from a background here at Canon where I've been here for 35 years this December. So I've seen a lot of growth in the product line over the years. I've been mostly focused in the X-ray and vascular space over those years. That's my expertise. And I've seen it from not only the engineering side and the service side, but I've seen it from the sales and marketing side as well.
When this comes out, it'll be right before RSNA. And I'm sure you've been working really hard on everything that Canon's going to be doing on the vascular side at RSNA. What can the folks who make it to the Canon booth expect to see from your team?
Well, we're happy to announce this year that it's the 30th anniversary of one of the most incredible technologies that we've come up with. And the theme right now for Canon Medical at this year's RSNA is meaningful innovation. And one of the most important meaningful innovation products that we ever came up with was a combination of combining a CT scanner with an angio lab. And people call that angio CT in the marketplace. Our term for it is 40 CT, because it gives you not only the CT, but it gives you the time element as well of being able to utilize the CT scanner right in the intervention. And it allows you to eliminate things like transferring from an interventional CT room down to where your angio suite is, and put it all in one space. So it's very quick and easy to switch between them. And of course, you get the incredible image quality that comes from CT imaging of soft tissue items like liver tumors or brain tumors or other things, anything that would be aided by CT imaging, along with the combination of the angio imaging at the same time. That's going to be the focus point this year, is the 30-year anniversary. And we're going to be blessed with Dr. Arai, who is the father of 40CT. He will be joining us for the meeting there at the booth.
How great. And what an amazing innovation. Can you just tell me a little bit more about the technology and then also the clinical impact of 40CT?
On the screen now, Jake, you can see what an angio CT room kind of looks like, okay? And what it allows you to do is do a different type of imaging clinically. Right now, probably the standard in the market is something called cone beam CT, or CT-like imaging, where the angio C-arm that you see hanging from the ceiling in this picture can spin around the patient, and it can do a type of imaging that allows them to see soft tissue, things like tumors and other things like that. And one of the important things that we're trying to do is we're trying to localize those tumors and be able to embolize them or ablate them, depending on the type of procedure you're doing. And the only way to see that is with that soft tissue imaging. Now, the downside is that cone beam CT has some limitations. It takes a little bit of time to actually acquire that image. It doesn't have the same low contrast detectability of a real CT scanner. So the quality can be a little bit less than what you can get with a regular CT. And also the coverage, how much you can actually cover on the patient becomes an issue. And for the larger patients, and welcome to the United States, there are large patients here. The larger patients, it might be difficult to not get a bit of cutoff on certain organs that you're trying to view. When you put that table that you see there, that patient table, into the CT scanner, you're going to get a very wide coverage, up to 50 centimeters of coverage, that's going to eliminate missing anything that you need. And you'll get the much better low contrast detectability of the CT scanner, plus the speed at which you can actually acquire that CT image. It just really makes it so you get less motion artifact, you get better coverage, and you get better detectability of your low contrast. So it's a better technology. And frankly, that's where angio is now moving towards, is having those types of technologies available so that physicians can be faster, more confident in their acquisition of those images, and to make sure that they don't miss anything and they have a better outcome in the long run.
Right. So you mentioned a couple of minutes ago how much evolution you've seen over these 30-something years. And then just now you're talking about this latest innovation. What are kind of some of the overall ways where you're seeing interventional X-ray evolve?
Well, there's two things, and let's talk about angio-CT first. If you look here at the first angio-CT that was ever built by any vendor, and this was deployed in 1992 by Dr. Arai, you see here is the father of this concept. And back then we put together an angio room. And if you look at just the makeup of this room, it's obviously not as much new technology as you can see from the current systems that we have now. But the big thing is, if you look at the CT scanner, those who are on the call that understand it, you can see that the detector that's on this CT scanner is maybe 1, maybe 2 centimeters wide at the most. When you move forward to the new technologies and you look at this CT scanner that's on this image, that detector is 16 centimeters wide. So it gives you the whole organ in one rotation of the CT scanner. And that can rotate as fast as 0.35 seconds. So that's faster than you can blink your eye. So you can get the whole organ much quicker, and you don't have to have a helical scan. And then when you put on top of that these abilities of these new C-arms and how they can move around the patient, this is just showing you a movie of how that works here. And the flat panel detector that's on there now has a much higher capability. And in our particular case, this flat panel detector that we sell on this unit has what's called an HD76. It's a high definition detector that has over 2 times the resolution of any other detector. So it allows you to not only get great CT imaging, but it also gives you this incredible high resolution that's in the angio image itself. So Jake, let's take a look at what I meant by that coverage of the detector itself. Now, this is a picture of a liver area on a patient. You can see that when you have a 320 row detector that's 16 centimeters wide, you get a lot more coverage of that in one view. And what that can mean also is that you can get dynamic imaging of that liver now, where you can actually, with the CT scanner, acquire the image in a dynamic mode. And it makes it possible then to do not only great identification of where the feeder vessels are that are going to these tumors that you want to do the intervention on, but you can also do physiological imaging on our system. This is perfusion that you can actually do on that liver. So now you can actually see the effect of either your ablation or of your embolization and how that's going to impact the liver. We can also do spectral imaging on this system that allows you to look at different aspects of the contrast and gives you better standout for that, identifying the high KV and the low KV aspects of the image. That's what spectral imaging does. It does a fast switching between the two KVs to give you a better view of the image. That's available on this system as well. And we can also use our integrated deep learning capability to draw out noise reduction in the image by lowering the dose, but reducing the noise and being able to see more clearly. So all those things are advancements that never were available back in the 90s or even the early and mid 2000s. These advancements have all moved forward now and what's available now on systems, and you'll see that at RSNA. Now, looking at that from that spectral, you have a wide variety of areas where this angio-CT, 40CT system can actually apply. It not only applies in the oncology and radiology space, but we also have it now in the cardiology space where it's helping out with TAVRs, it's helping out with left atrial appendage cases. We have it in a neuro setting where we actually do acute stroke intervention right on the table. And we just got done with a SIR meeting, trauma meeting that was down in Orlando, and we can see how this type of capability with these systems can be used for acute trauma, whether it's a auto accident or it's a gunshot wound and it's a knife stabbing, something like that, where you can really use this technology quickly to be able to help your patient without going to surgery. And so when you think about that, you can see how it has a wide variety of capabilities for your hospital, and they can get a great return on their investment from this system.
Right. And that's actually, it's funny that you just brought that up, because I was just going to ask essentially how a hospital would go about justifying moving to a system like this.
It's a great question. And we did a study at one of our sites at the University of Chicago, where they took a look at before they had the angio-CT and then after they had the angio-CT. And we benchmarked all of that so we could see the results that came out from that from a financial aspect. And you could see in the middle view there, the 23% increase in revenue that came when they actually put the 40CT in place. And part of the reason was, right now, a lot of departments that do interventional CT, a lot of people use what's called CT fluoral, and they'll have a CT scanner that's dedicated. It might be outside the department or way down at the other end of the department. And they'll have to dedicate that CT scanner to just doing those types of cases. And that means that they have to buy extra CTs to do their diagnostic CT, all those different things come into play. Well, when you put the angio CT in, the 40CT in the department, because it comes with the ability to do the interventional CT fluoral on the system, plus you have the ability to do needle guidance on the angio system itself, it speeds up the ability to do CT fluoral work, and it puts it all in one room. So you're not transferring the patient from one spot to another. If you're in the middle of either some type of interventional case, like doing maybe a TACE, where you're actually putting coils into embolize a tumor, and you wanted to get a CT view of that, you'd have to roll them down to the other CT scanner in the department. It takes up time, it takes up energy, it takes up staffing issues. So when they move it into this, their ROI goes way up on the system.
Bill, thanks for the great information on the ROI. I'm curious, when we talked about the advancements on the imaging on the CT side, how is the imaging quality being advanced on the C-arm side?
That's a great question, Jake. Let me show you what we've done with that. We have this high def imaging that I mentioned earlier. A lot of folks have asked, okay, what the heck does that mean? What it means, and we call it HD76, by the way, because it's actually a second detector that's built inside of the actual flat panel detector, the angio flat panel detector. So you have a piece inside of that that's at 76 microns. That's where we get the 76 on the HD76. And what it allows you to do is it more than doubles the resolution of the image. So if you were to look at a flat panel detector that's got different mag modes that you can see over here on the right side of the image that are the standard view modes. Well, now with this HD76, you get 3 extra mag modes that allow you to step through your mag modes. And now you go into a high resolution that's over double the resolution, all the way down to a 1.5-inch mode. And so you can really zoom in on a device or an area in the anatomy on the patient. Now, this was originally designed for neuro to begin with. And you can see the neuro stent that's in the middle of this skull phantom, and you can see the detail that comes out in that. Well, now we've transferred that over to the 12x16 flat panel detector, that big one that you saw, that allows you to do the same thing into the angio world. Here's what you kind of see in the neural world. If you look on the image on the left side, you can barely see this device that you see over on the right, barely in there. This is the same patient on a biplane, the same time. One is the AP view, the other is the lateral. The one on the lateral on the right side, that is the 1.5-inch mode, where you really see the high detail of this image. You can't do this any other way than with this HD76 panel. And it's really transforming the way that physicians can visualize the devices that they're deploying, not only in neuro, but also now over into the angio. Here's an IVC filter that's being pulled out using the HD capability that has just made it possible for physicians to see things that were very difficult to see in the standard mag view that you see over on the left. Well, over on the right, you can zoom it up now and actually see exactly what you're trying to grab. You can also see different coils that you're putting to coil those different parts of the body when you're trying to embolize. You can see how it really gives you much more detail, much more confidence that you actually accomplish your goal. And now even coiling for any type of thing that you're trying to do, it's giving you a much better view. You can actually see how the coils are responding. In the peripheral world, you can actually see how those stents that you're putting in actually are being deployed and actually in position. So this is a tremendous technology advancement. So not only do you have on the 40CT the great technology advancement of the wide area detector CT, but now you have this high definition HD76 capability in the angio side as well.
So for the folks who are watching this and they've seen 4D CT in action per se, and they have a feel for how it might help their own teams and their own patients and just improve overall operations in this area. But obviously they're going to want to learn more before they make any moves like this. What's the best way for them to learn more?
Well, there's a couple of things. If they're coming to RSNA this year, we'll be at the booth. I'll be there. I'll have a team there that can go over all this information. By the way, that slide I showed that showed all the different ROI, that is an actual paper, a clinical paper that we have that we can send to you. You can come to the booth and we can get that sent to you. And by the way, if you wish to, you can talk to the physician that spearheaded that. And if you do also come to RSNA this year on Wednesday at noon, there will be a lunch and learn where Dr. Arai, the father of the 40CT, will be there, and you can actually see his presentation and talk to him if you'd like, and get more information there as well too.
Okay, and then follow-up question about RSA. So for those folks who are going to RSNA, but maybe
get more information there as well too.
Okay, and then follow-up question about RSA. So for those folks who are going to RSNA, but maybe could use some advice for somebody who's been to a couple RSNAs in the past. What are some words of wisdom that you have for the folks heading out to Chicago to make the most of their visit to the city and for the show?
Well, I've learned the hard way. Right now, if you take a look at what's going on in Chicago weather-wise. It's like 62 degrees there today. Beautiful day. Don't be fooled. I've had it be like 4 days, 5 days before it's 68 degrees. And then when we get there, we end up getting 6 inches of snow on the second day or something like that. So I would recommend, if you've not been to RSNA before, make sure you think about bringing at least one coat of some kind that you can stay. Because when you're in that taxi line, trying to get to a restaurant that you're going to, and you're standing outside and it's a little dreary and maybe a little drizzly or a little sleety or a little snowy, and the wind is blowing off the lake and it comes right up to that front door at RSNA, it blows a good 20, 30 miles an hour in your face. And that line is a long line. So you'll be out there wishing that you had a coat and a scarf. So I would recommend that you think about it, unless you're from the great north of the United States of America and you're not shaken by that. I'm from California, so that stuff goes right through me when it's cold like that. So I recommend that.
That's really good advice. All right. So you heard it, folks. Make sure to bundle up when you go to RSNA, and then also go check out Bill and his team and what Canon is doing in the 4D CT space. If this is a part of Imogen that you're involved with, I mean, I think it was pretty clear about how this really can support both workflows and hospital efficiency and patient care. And those are extremely important things. So Bill, thank you so much for coming in and sharing.
Thank you, Jake.
And thanks for watching, everyone.